Here's 10 multiple choice questions to test your clinical knowledge, okay? If I'm going fast, make sure you go ahead and pause the video after each section if you need time to think it through, all right? Drop your score down below. And guys, listen, the rationales will be in the caption, okay? All right, so question number 1. Which priority clinical assessment indicates that a client has sustained an inhalation injury from a fire? So the answer is B, a hoarse voice and singed nasal hair. Question number 2. Which clinical findings make up Virchow's triad for the development of a deep vein thrombosis? So the answer is A, blood stasis, endothelial injury, and hypercoagulability. Question number 3. A client on bed rest is diagnosed with a deep vein thrombosis in the right calf. Which action must the nurse avoid to prevent a pulmonary embolism? So the answer is B, massaging the affected extremity. Question number 4. A client with suspected appendicitis reports a sudden, complete relief of their right lower quadrant abdominal pain. What is the nurse's priority action? So the answer is D, notify the healthcare provider immediately. Usually this means there's a rupture. Question number 5. Which assessment finding is a hallmark sign of a client developing peritonitis from a perforated bowel? If you answered B, a rigid board-like abdomen, you got it correct. Question 6. A client who underwent gastric bypass surgery 2 weeks ago asked the nurse why they need vitamin B12 injections. What is the correct clinical rationale? So the answer is B. The procedure reduces intrinsic factor production that is needed for B12 absorption. Okay? Question number 7. When evaluating the laboratory results for a neutropenic client who is undergoing chemotherapy, the nurse notes a temperature increase of 1.0 degree Fahrenheit above baseline. What is the priority interpretation? So the answer for this is C. It can indicate a life-threatening infection. Question 8. An alert client presents with a blood glucose level of 48 milligrams per deciliter, tremor, and diaphoresis. According to the rule of 15, what should the nurse administer first? So the answer is C, 15 grams of fast-acting carbohydrates, like a half a cup of juice, okay? Question 9. The nurse is reviewing the electrocardiogram of a client with an acute kidney injury and notes narrow, peaked T waves. Which electrolyte imbalance is the priority concern? So the answer is B, hyperkalemia. Question number 10. The nurse is assessing a client following a traumatic brain injury. Which finding is the earliest sign of increased intracranial pressure? The answer is B, a change in the level of consciousness. Okay, so that's it for this video, guys. Thank you so much for watching. I really do appreciate your participation. Go ahead and leave your score in the comments. Let me know how you did. And remember to check the captions for the rationales, because they will be in. Remember to check the caption for the remember to check the caption for the rationales, okay? And listen, I'm going to always leave you with this. Never dim your light for anyone. Stay lit.